Theo, and I'm a DPT student at Nova Southeastern University, and today we will be doing a wound examination. First thing I'm going to do is put on my gloves. Alright, so to get started, we're going to look at our wound. The first thing we're going to notice is the location. So it's located on the left leg of the patient. It's on their distal lower extremity, so the lower leg. It's between the medial malleolus and we're going to say between the gastroc muscle belly. And so I'm actually just going to measure it just in case another clinician comes in to look at the wound. We're going to start the medial malleolus and we're going to use centimeters. We're going to come up to the wound and we're going to say it's about 8.5 centimeters from the medial malleolus. The next thing we're going to look at is the shape. So there really is no defined shape, so we're just going to classify that as it's irregular. The next thing we're going to look at is like the wound color. So what we have for wound color is there's some yellow slough in here, so we're going to categorize yellow as about 70%, and then we can see this red right around just kind of it's in the wound but on the outside of the wound, which indicates that it's healing. So the red we're going to say is about 30% and 70% yellow slough. The size we're going to go ahead and measure. We're going to use the clock method, so we're going to say that his head's up here, so this is 12 o'clock and then this is our 6 o'clock. And so we're going to measure, and we are getting about 3 centimeters from 12 o'clock to 6 o'clock, and then we're going to measure from 3 o'clock and 9 o'clock. Again, we're getting about 3 centimeters. So now we're going to measure depths. We're going to take our Q-tip and we're going to measure the deepest part of the wound, which we're going to say is right here. Alright, and so we're going to measure on our little stick, and we're going to say it's about 2 millimeters. So now that we have our depth and our size, we're going to go ahead and look at the temperature of the wound. And what we're going to do when we test temperature, we want to test both extremities. So I'm actually going to take the back side of my hand and we're going to test this side. And it feels good. And then we're going to come over to this side using the same hand. Just kind of hover over it. It's a little warm, I'd say, compared to that side. So a little warm. The next thing we look at is infection. I don't really see any infection, but I do see a lot of signs of inflammation. So we'll just point out a couple of those signs. There's a lot of edema around here, which we can see, just a lot of edema. And that's our tumor. So for our dolor, our patient has been complaining of a lot of pain. And then our rubor, so our red is which we would indicate for inflammation or infection. You can tell that it's inside. It's very proportional to the wound, so it's not extraneous. So that is our infection signs. Non-infection signs, those are inflammation signs. So now let's categorize the wound. The wound, as we can see, is there's a red granulation tissue, which indicates that we have some revascularization occurring, which is what we want. We don't see any undermining, we don't see any tunneling or fistulas around the wound, which is great. However, let's go ahead and look at from 12 o'clock to about 4 o'clock, we have nice distinct wound edges, so they're nice and intact. But right here from about 4 o'clock to 7 o'clock, we're getting some rolled edges right around in here. And then again, the wound looks really great between 7 and 12 again. So our peri wound, so that was our wound. Our peri wound, we have that nice pink granulation going on, which is our scar tissue, which indicated that our wound was once a lot larger and it's getting smaller, which is what we want. We also have a lot of this edema going on. So what I'm going to go ahead and do with my patient is we're going to do an edema test. So I'm going to hold down for about 5 seconds. So we're categorizing this pitting edema, let up. Okay, so it's taken about 15 seconds, so I categorize this pitting edema as a grade 2+. We also see this hemosiderin staining from here to here, which is very consistent with a venous ulcer, which is what I'm going to indicate this as. Lastly, let's look at the temperature of the peri wound. Again, we're going to take the back side of the hand. We're going to test the other side again just to kind of see how that temperature feels in comparison to this side. So the peri wound, I'm just going to get on this side. And it's about normal, which is good. We have a little, maybe just a little bit of increased temperature, which is consistent with edema and the swelling. So now drainage, what we have here is we have a copious amount of drainage. It is serous, it is watery, it is thin, again consistent with a venous ulcer. So last thing that I want to do is I want to check the odor. So I'd irrigate the wound, clean it up a little bit, and then smell it. And there's no odor, which is good, no signs of infection there. And then I want to do some pulse tests. So I'm going to take off my gloves. I'm actually going to do I would do the pulse test on both feet. So I'm going to do the dorsalis pedis. Good. And then I'd also do the posterior tibialis, which is good. I categorize this side as normal, and then we go ahead and do this side also again. The dorsalis pedis is normal, and then the posterior tibialis is normal grade 2. And that is my evaluation of this wound. It's from what I would categorize it as a venous ulcer, a C6, but it also has some hemosiderin staining. Thank you.